So we have Dr. Satanshu Mathur, who is now perhaps the main force behind this meeting as its organizing secretary. He is a very prolific surgeon and a very, very enthusiastic person in all organizations, AIOS, the Uttarakhand Society, ISMS-ICS. So, Satanshu sir, if you could tell us more.
I thought I will not have to speak, but one speaker is missing, so I have to come to speak because still we have time. So, this is a video-based session because this is not the technique for the persons who are starting the SICS surgery. If you have mastered the SICS surgery, on to the video. If you have started the, so this is, once you have started the SICS surgery, mastered the surgery, then you go for the, because this is the nuclear division, means you have to remove the nucleus from a small incision. So what is the steps in nucleus division? This is the nucleus management. So what are steps? First is dislocated nucleus out of the bag, then deliver nucleus into the antechamber, and then deliver nucleus out of the eye. So these are the basic steps in any nuclear delivery. So what are the techniques for dislocating nucleus out of the bag? This is hydrodissection technique or the dialer or hook technique. We have two dialers. Prerequisite for easy nuclear plus, adequate size axis, good hydrodissection, adequate size corneal scleral incision. Do not hesitate to make a big incision if the nucleus is hard. Surgical goal is protect the corneal epithelium and preserve the capsular bag. These are our aim of the any surgery with phaco-SICS. This is the hydrodissection technique. We push copious amount of fluid on one side. In one single push of the fluid, nucleus comes out, and then we rotate it and then pull aside. This is dialer technique where two dialers are used. Rotate the nucleus, push on one side from dialer and take it out of the nucleus. So there are two techniques to bring the nucleus into the antechamber. Where the hydrodissection technique for the soft catheter and the hard catheter you use the dialer technique. This is a basic skull tunnel. The external incision, normally this is for the beginners. So minimum 6.5 you have used, 6 or 6.5. Then internal incision becomes 7.5. Once you have master surgery, now we are doing from 4 millimeter. One of Dr. Sahu is doing from 2 millimeter incision also. Many of us started doing 2 millimeter. First, starting surgeon should start from a big incision. Because big doctors, you have to become the big doctors, you have to make the big incision initially. So this is the once outside, 1.5 millimeter from away from the limbus and 1.5 millimeter into the inside the limbus. And inside incision you have to make side pockets that make the incision 7.5. So you have increase the intraocular pressure inside the eye. The nucleus comes out once you engage in the wound area, pass over the posterior lip of the wound, like a fish mouth is opens and nucleus comes out. So this is the basic principle. There is open and closed chamber surgery. When we lift the upper lip, we close the groove. When press over the lower lip, we divide the groove. There's a, now I come to the point that once you master the SICS surgery, you have to make now the incision smaller. So you have to fracture the nucleus. It can be intertunnel fracture, it can be fracture in the antechamber. So there are different techniques. You can try every technique. Whatever you like, you can do it. Because we have tried everything, now we are come to this is the best for us. Intertunnel fracture. Increase the, this is the nuclear antechamber, vectis. Incision is small, so when it comes in the wound area, it divides it two. This is the irrigative vectis. Take it out. It divides itself in the wound area because it is small. We again go inside and we take it out. So we have once incision is small, so itself nuclear divide at the wound area. It does not cause endothelial damage because we are at the tunnel level. So once you have come to the intertunnel level, it will automatically divide two parts because there is no space to come the nucleus as such. When the second part is remaining there, you inject the fluid, inject the viscoelastic and take it out the second part. This is the fish hook case. Fish hook is simple 26 gauge needle. We bend it like this, and once we go inside, because size of the incision is small, so it will automatically divide the wound area. We go inside, hold it, take it out, and you see we are taking out in total. This was bigger incision. Now in the fracture technique with the same fish hook, we have kept the incision small, so it will divide automatically in the two parts. You see, this has divided automatically into two parts. One part has come out, one inside. So initially we have to try always with the big incision, and then we have to try them with a small incision. Now again injective fluid, viscoelastic and the nucleus is beginning in the center, and second part will be moved by in second attempt. So in first case we have taken out in toto, and then here we are taking out two pieces. So every technique we can divide the nucleus two parts. This is fish hook made by 26 gauge needle. This is sandwich case. In first case we take it out as in toto. The whole one vector goes behind and the second dialer goes in front of the nucleus. Hold it and take it out. It's a very good technique for the hard cat. We are taking out in toto. Means incision valve is big. Now you want to break the nucleus. So make the incision small. Again the same thing, one instrument goes behind and one instrument over the nucleus. This is simple as depositor. Nucleus is divided in two parts. You can see one part is still remaining inside the eye. Okay. So now you inject the viscoelastic, again go inside and take out the second part. So in every technique you can divide the nucleus, you can came out in toto. This is viscoaspiration technique. Just inject the viscoelastic behind the nucleus, press over the posterior lip of the wound, nucleus will come out automatically. Because nothing is going, instrument is going inside. This is a very safe technique because your instrument is not going inside. You can take it out easily. This is removal of the nucleus in toto. Then viscoaspiration, when we want to remove the nucleus, in divide in two parts. This is cannula takore, you see. What we are showing, we are same thing we are doing. This is a special instrument. We go just behind the nucleus with this is 20 gauge cannula. Just press and nucleus comes out. Viscoaspiration. We can name it anything. This is the hardest nucleus, we can take it out. We are just taking this cannula, I want to show this special cannula. So that goes inside and just that the viscoelastic comes out. This is blow menthol technique where we have to induce a infusion cannula at the 6 o'clock and then nucleus comes out automatically because there is increased pressure inside the eye. So there are different techniques to remove the nucleus outside the eye. We have shown almost every technique that is available in the world for nucleus removal, and then you can see what technique is good for you. Then manual fracture. We can divide the nucleus manually also inside the eye. This is the second instrument. First instrument go now. We have divided the nucleus in two parts by the dialer only. Then this is a snare that was used, I am not using nowadays. We can use this snare, you cut the nucleus in two parts and then you can take out the one part one by one. So there are many techniques to divide the nucleus intertunnel and the inside the eye. This is snare technique. This is snare that is available in the market and then you can divide the nucleus in two parts or three parts, whatever you want. That Ramesh Shah is very, and you can see the incision is 4 millimeter. In all the cases, incision is almost 4 millimeter. So there are different techniques to use in the SICS. You can use whatever you like. Once you master the surgery by 6 millimeter, then you come to the 4 millimeter, then you come to 2 millimeter. So we have many options in SICS, not so many options in FICO. So one of request to all of the younger generation also, beyond this ophthalmology, you should become the member of FBS. FBS is Family Benefit Scheme. Especially for the younger generation, you have to pay very less to secure your family. Don't think that your life is, pray for your long life, but you not secured. So you should not think that we are going to live many more years. You should join the family benefit scheme, very good scheme. There is a stall near the SSCC area. Go and know the benefits for the younger generation to become the members. Thank you.
Thank you, sir. And we have still about 2-3 minutes, so we can take an odd question in case there is one.